To acquire a high-quality image of the fetal brain, you need to be very careful about the shadows. Because normally when you keep the midline echo perpendicular to the beam, you can see that the lowest part of the cerebellum is hidden behind the shadows. If you make the acquisition at this point, you may form the impression that there is something wrong with the lowest part of the cerebellum. So you need to be careful. This is why it is more recommended to have the access through the lateral fontanelle. Then you need to bring your TCD view slightly oblique. Then you can see the cerebellum nicely together with anterior aspects, so cavum septi and anterior horns. This is very important because you will avoid these shadows that form behind the parietal bones. When both structures, cerebellum and the cavum septi, is nicely seen, as for nuchal fold, you can prepare your acquisition. I wait until the fetal is quiet. I correct my position. This is 22 weeks, so I will use the angle of about 60 degrees, and the quality is kept high. I'm using high 2 in this case. Now I will start with the process of acquisition. You see that the oblique position is there. I will activate 3D and I will try to watch the fetus. I can see that the cerebellum is there. The cavum septi is also clearly seen. The fetus looks quiet. I will initiate the acquisition. You could see that it went smoothly through the views of the brain. Now I will move to the sectional planes, and here I will make the orientation. After I'm orientated, I will try to present the mid-sagittal view of the brain. So let's try to do it. First, I need to change the slice of my VCI because it is 20 millimeters at the moment. I will reduce to several millimeters, like 2, 3, not more. And I will decrease the size. Then I'll bring my pivot point exactly to the midline, and I will correct the position of the midline, and I will bring it horizontally, same as in A as in B. So let's do it. I'm having the reference image A active. I do the Z rotation here, and I move to reference image B. I correct this, and the result comes in C. So this is our goal, where we use 3D for the brain. In cases where we suspect midline problems or the anomalies of the cerebellum. So let's rotate the C-plane, because this is our C-plane, but it is not in the position, so you hardly can see the anatomy now. And when you rotate this, then you get the view of the midline here. This is the cavum septum pellucidi corpus callosum complex. Here you see the aqueduct, and this is the cerebellum. We properly reconstructed the sagittal view here. You can also use multiplanar for the precise evaluation of some organs or parts of the brain. So let's try to do it on cerebellum. I'll bring my pivot point in the C-plane to the cerebellum. Here you can see. And now cerebellum is displayed in all the 3 multiplanar views. So these are the hemispheres. This is the vermis. This is the vermis we just presented in the coronal view. you can do it by navigating with the pivot point. This is the potential of multiplanar view. Same you can do with tomographic imaging. I will bring my pivot point to the level of cavum septi now, and then I will make the tomography of axial view. I need to change my reference image to A, and then I will do tomography. Here, by changing the distance between the slices, you can present all the major views across the brain. You can navigate with this. For example, the parieto-occipital feature is seen here. And you can move the complete set of the views. Here you reach the level of the cerebellum. So again, the fetal brain has potential in volume ultrasound because you can use many tools in presenting the basic views of the brain.